Hi, I'm Dr. James Machino. What causes low libido and reduced sexual desire in women? And what are the natural solutions that can help? Well, according to some studies, about 40% of women complain of sort of low sexual desire at some point. The percentage is smaller, about 5 to 15%, that women who sort of have ongoing low libido problems. And there's a number of causes. As you might expect, emotional and psychological reasons are sort of, part of what goes on. And there are some prescription drugs that can kill sex drives. Many antidepressants do that, antihistamines do that, a lot of blood pressure medications do that, and chemotherapy drugs also. But there are physiological causes, and I want to deal with the sort of the physiological causes because they're often at the root of it. And solving the body's sort of sexual physiological issues, regardless of everything else that's going on, I've seen that it can actually improve libido and desire, increase the ease of achieving orgasm, and also increase sensitivity of the genitalia and increase their responsiveness. So what are the main physiological causes of low libido and lack of desire? Well, there can be a decline or an imbalance in estrogen, progesterone, testosterone. So, as a woman gets older, as estrogen drops down and progesterone drops down and even testosterone drops down, that can be an issue, especially around menopause. But even in younger women, there can be an imbalance or sort of a dipping of some of these hormones. So having your blood and saliva levels checked to see what your actual hormone profile looks like is valuable to know. But before you use hormones to solve the problem, I want to bring to your attention that there are some natural solutions that I've seen work extremely well. And so the reason I wouldn't jump into using hormone replacement right away, whether it's traditional hormone replacement or even bioidentical hormones, is because when you give women estrogen, it increases often the rate at which breast cells divide. And when cells divide too quickly, it increases the risk of cancer. The other thing that we've seen is that too much estrogen being put back in artificially can make blood really, really sticky and form abnormal clots that can lead to a stroke or a heart attack or some kind of vascular event. So I'm not crazy about putting estrogen back in unless it's absolutely necessary. I do like natural progesterone, not synthetic progesterone, but I like natural progesterone. And with testosterone replacement, although testosterone affects libido, I'm not crazy about it. A lot of women don't like it because it has masculinizing effects where they start having more hair growing on their body or on their face and their voice starts to deepen. So I wouldn't jump into testosterone replacement right away if it's not necessary. And remember that a lot of women, even after they go through menopause and they're even postmenopausal, even though those hormones are low for them, that their sexual desire and their libido stays intact. So hormones are not the whole story. And that brings me to what I want to discuss with you, that there are some natural herbal agents that have been shown to be very, very useful. At the Institute of Sexology in France and other clinical research centers have shown that some of these supplements are absolutely outstanding. For women, they're good for men as well, but they're underappreciated for women. So let me just tell you what some of these natural herbal agents are that you might want to consider because they're very safe. Tribulus terrestris is one of them. Tribulus terrestris is an herb that contains saponins, and these saponins cause a release of nitric oxide. What nitric oxide does, it increases blood flow to the genitalia, and so you get more engorgement in the genitalia area. That increases sensitivity and overall sort of ease of arousal, if you will. And greater sensitivity means more nerve impulses getting into the central nervous system and making it easier to reach orgasm, in fact. Then in Brazil, they discovered years ago that an herb called Muira puama had not only aphrodisiac sort of properties, but also was sort of a nerve stimulant, increasing sensitivity and arousal of the genitalia, not just for men, but also for women. And it's listed in the British Pharmacopoeia as sort of an agent that improves aphrodisiac behaviors and responses. Then there's an herb called Avena sativa, which increases the tactile sensation and pleasureful sensations that are available from the genitalia. In a recent study, 15% of women were able to document from interviews and sort of post-marketing surveys that there was increased genital sensation that they experienced after using it, and also that there was a 29% increase in ease and frequency of achieving orgasm. And of course, maca root has been around for a long time, used as an aphrodisiac herb. And then there's epimedium, which also has been shown to be very useful to increase sort of sexual desire. And we think it's because it's raising the brain levels of dopamine. Dopamine is sort of the brain's sex neurotransmitter. When your dopamine levels are higher, there tends to be a greater likelihood there's going to be sort of sexual arousal available. And also Damiana, which has been shown to increase sensitivity of the genitalia and sex organs as well. So the synergistic effect of all these herbs, when they're sort of together in one combination, has been shown to increase blood flow to the genitalia, increase the sensitivity of the genitalia, and sort of increase a feeling of libido and sexual desire. And this is true not just for men, but also for women, and has helped them more easily achieve orgasm. So there are clinical studies to show the efficacy and safety of these herbs. I think they're really underappreciated. There are some dangerous supplements or dangerous herbs I don't think you should use, so you have to know what you're doing. So what I've done is I've explained all of this in the ebook that's available right here. It's called Effective Natural Remedies for Sexual Performance and Libido, a guide for men and women. So if any of this is of interest to you, you should really download that ebook right now and sort of try to get a combination product that has those agents in it and use it according to how it's recommended, and I think you'll be very pleasantly surprised with the outcomes that you might experience. And so I think that's the first thing you do before you start using hormones, because of the risk of some of the hormone replacement therapy that we've seen in the clinical studies. Anyway, remember that at machinohealth.com you'll see my other research review papers, other downloads and videos that I've created, footage from my live professional seminars, other resources that I've put there that will help you lead a long, healthy, functional life, so you stay functional as you get older. My research papers and teaching materials have all the scientific references in them to make sure you're getting only evidence-based information on any health or wellness subject that you're looking for. So you should, on a regular basis, use machinohealth.com as an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.